So today is the 18th of July 2014. My name is Raffaele Ippolito, and this interview is for the Ming-Ai London Institute British Chinese Workforce Heritage Project. Could I begin by asking your name?
Mr. Ching Kun Liu, surname Liu.
And where were you born?
In China, Tianjin.
So what educational qualifications do you need to enter Chinese medicine?
Basically, you need a university honors degree, first degree of Chinese herbal medicine.
And do practitioners tend to focus exclusively on traditional Chinese medicine, or do they also work within Western medicine?
You mean in China or in here?
Yeah, both in China and the UK.
In China, they work Chinese traditional medicine. They work along with Western medicine. They have a traditional Chinese medicine hospital, but they also with a Western doctor work along together. But in UK, I think that's not the case.
Okay. And can you tell me a bit more about your practice? What services of practices does it offer?
The clinic, we offer Chinese herbal medicine, acupuncture, and that's all we do.
All right. And have these services changed over the years?
Yes, it's changed over the years. I think on the 2011, we have in this country we have a policy. After 3 years, the prepared medicine are not allowed to given to the public, and that's been happens on the on the end of April this year. Yeah.
And why do you think these services have changed?
I think the quite many reasons. One reason is there are some probably some problem on the process of preparing prepared medicine. The quality control is not meet the standard of European law, so that's why they stop coming to this country. So they are slightly changed. So in the market now, we still serving the public like acupuncture, herbal medicine like herbs, but not the prepared medicine. That's a slightly change. Everything else would be the same.
Right. Which of the services that you offer are the most popular?
It varies. Like say in the summer, the more people like they have asthma, eczema, or the hay fever. In the winter, the more people have like rheumatoid arthritis. Like the cold, cough. Yeah.
All right. Who mainly who tends to come to the practice mainly?
We are in Chinatown, so most people come Chinese people, but there are some European, Indian people, other races come. Yeah.
And among these Chinese people, are they mainly women or children or
all type of people? Yeah.
Okay. Do the demands of different groups differ? Like, do different people demand different things?
Yes, they demand different things. Yeah.
So, for example, what is the kind of service that Chinese elderly people demand, and a service that is more?
It really depends on what the problem is. Like elderly people, they more they have a more problem is that they already been, say, NHS, the GP, and they been treating for long term, and they think some alternative treatment would be also can be useful, because some of the problem probably is it would be carry along for the rest of their lives, so they come to see us.
Right. And what specific health needs do Chinese users have, and how do you accommodate these needs? How do you satisfy or accommodate the needs of the people that?
Basically, first we see whether we can treat them or not. If we can't, we just tell them maybe they go back to see the GP, go to the hospital. We give them some advice, and then if they think we okay to treat them, then we carry on.
Right. How many traditional Chinese medicine practices are there in Manchester?
I think they around 10 or probably under 20 clinic in Manchester. Yeah.
Okay. And what sort of quality of service do these practices offer?
Quality. We don't know too much, but I suppose they should be okay. Otherwise, they would not survive.
Right.
Yeah.
Do you have any interaction with the local NHS?
Local NHS interaction. Used to, a few years ago, we have some hospitals send us some patient for the skin problem. They tell us using the herbal medicine to treat, and after that we can claim the cost from the hospital. They normally send us a check, but that's been happened for around a few months, and it was stopped because probably they haven't got the budget to carry on it.
All right. And do you usually have any other interactions with them? Or?
No.
Okay. Do you have interactions with the Manchester Chinese Health Information Center?
No.
No. What is your relationship with the Federation of Traditional Chinese Medicine Practitioners, the Association of Traditional Chinese Medicine, and the British Acupuncture Council?
I think I'm the relation with the
Traditional Chinese Medicine practitioners.
The middle one.
Traditional Chinese Medicine.
Yeah.
Association of Traditional Chinese Medicine.
Yes. Yeah, I'm a member of that association. Yeah.
And what does your role involve within that association?
The role we just we receive their annual I think is a catalog from them, and tell us what happens in the Chinese medicine information, which is, and we annually we pay the annual fee to the association. Yep.
Right. Okay. Has the provision of medical care for Chinese people in Britain changed over the years, do you think?
Medical care for change over the years. You mean the NHS?
Yeah.
I think they are changing over the year. We can see the how to say it. I think the service is getting better. Yeah.
Okay, and how? In what ways are they getting better for Chinese people?
For Chinese people, before we don't have this Chinese health. How to say this clinic in Chinatown. It was only about last 5 or 8 years we have this this place. So I think they are one or two GP are Chinese people, which is quite beneficial for the Chinese community, because a lot of Chinese in Chinatown, they actually doesn't speak English.
Okay, I understand. So has the number of staff and volunteers employed by the practice changed?
In our clinic?
Yeah, in this.
Not much.
Okay. How many people do you have working in this clinic?
We used to have 2 people, now only myself.
Only yourself. Now we're going to talk more broadly about traditional Chinese medicine. How does the education on Chinese medicine prepare you for the practice?
I had an honors degree for Chinese herbal medicine on China Xiamen University, and after I had that qualification, I start do the practice in this clinic. Yeah.
And what is the relationship between Chinese medicine and Western medicine?
They are kind of a supplement. For instance, you already been diagnosed a problem by Western medicine, but probably the problem is like some kind of pain. You've been using, for instance, painkillers, but for some people they have probably they also have stomach problems. They can't take painkillers, so Chinese medicine would offer another way, things like acupuncture, which also can release the pain, but doesn't involve like oral internal taking.
Right.
Yeah.
And how do you see the medical practices in China differing from those in the UK?
In China, we have this Chinese medicine for so many thousand years. So people in China, they have a more broad choice in China. We can, and for instance, if we have a problem, we either can go to GP or we can straight walk into the hospital. You can choose any hospital, just walk in, and then you can choose the doctor you see. But in here, probably the only doctor we can see is GP.
And how does the relationship of traditional Chinese medicine with the UK government and the lack of regulation affect the practice of Chinese medicine?
With the government, at the moment, the government is still we still have the choice of a practice in Britain. We can still give treatment for the people, and I think the government are working on it. Probably they can send more people to China and investigate, to study more about Chinese medicine, and probably one day they can decide what we can in Britain what we can change. Yeah.
All right. And would you like to see a government regulation of Chinese medicine in the UK?
Probably yes.
Yes. Okay, so I was actually wondering, would you mind if I asked you some questions about the Chinese community in Manchester, as Shirley asked you before? So, how do you think has the Chinese community in Manchester changed over the years?
Over the years?
Yeah.
It's been changed a lot, because before 30 years ago I came to this country, I came to Manchester, I think the community is quite small. Now we have more business in Chinatown and more Chinese people, especially we have so many overseas students these years. So it's and the young students, so they become more lively.
All right. And what do you think were the biggest obstacles for the Chinese community, I don't know, maybe 10 or 20 years ago in Manchester, and what are the current difficulties that the Chinese community experiences?
Difficulties?
Yeah.
You mean Chinese community?
The Chinese community in Manchester.
Difficulties? I don't see any difficulties.
Okay. Right. Shelley, is there any other question you...
With the increasing number of students, you say, from China, do they come to use your services a lot?
Yes, they do come with services a lot.
And so these students are mainly from...
China.
Okay. Right. Is there anything else you would like to discuss or mention?
It's okay, nothing.
All right. Well, then, thank you so much for participating in our project and sharing your memories.
Okay.
Thank you.